From the research bench to the patient's bedside, this is Bench to Bedside with your host, Vice Chancellor and Director of the University of Kansas Cancer Center, Dr. Roy Jensen.
Good morning. I'm Dr. Roy Jensen, Vice Chancellor and Director of the University of Kansas Cancer Center. I'm here with Dr. Priyanka Sharma, a breast medical oncologist and internationally recognized expert in triple-negative breast cancer. Also joining me is someone who may look familiar to many of our Kansas City viewers, Cynthia Newsome. She is an anchor for 41 Action News, which she used as a platform to share her breast cancer experience and raise awareness about the disease. She is the recipient of the Block Cancer Survivor Award, the Komen Kansas City Legacy Award, and the American Association for Cancer Research June L. Beadler Prize for Cancer Journalism. Cynthia, thank you so much for joining us. When you were diagnosed, and where are you on your breast cancer journey?
Oh my goodness. So when I was first diagnosed, it was 2011 with breast cancer. And then I went through a series of treatments, a lumpectomy, chemotherapy, radiation, and I was 7 years cancer-free. And then in 2019, I was diagnosed with metastatic breast cancer. I felt another lump and went in and checked. And, after all of the research and analysis, it was diagnosed as metastatic. So I am now, about a year and a half, almost 2 years into my metastatic breast cancer treatment with Dr. Sharma, my doctor, my oncologist, my clinical researcher. She's amazing. And I just, on this Thanksgiving month, November is Thanksgiving, and I'm just so thankful for Dr. Sharma and her team and just the care and concern and attention to detail that they give. Dr. Sharma, I just want to say thank you so much on this, Thanksgiving month, because you really do mean so much to me. It's my birthday month as well. So my birthday was November 9th. And so this is just one of those months where I just try to say thank you to those people who have made my life better. And so I really appreciate you so much.
So Dr. Sharma, tell us more about triple-negative breast cancer and how is it different from other subtypes of breast cancer?
So triple-negative breast cancer, number one, it is the smallest subtype of all breast cancers. And the reason we call it triple-negative because it lacks three common markers, which about 85% of breast cancers will have one of those three markers, either estrogen receptor, progesterone receptor, or HER2 gene amplification. So that leaves, if a cancer has all three absent, that becomes triple-negative breast cancer. It's different from others in the sense that it tends to impact younger women. It tends to impact proportionally higher African-American women. More patients in this category would have a genetic mutation that predisposed to this cancer. Most patients, like Cynthia just mentioned, would need chemotherapy to treat early stage disease. And when it comes back, it tends to come back a little bit earlier than other subtypes of breast cancer. I think the most unique thing about this is even though we call it one type of breast cancer, it is almost like a wastebasket term. Because it lacks the three receptors, we call it triple negative, but it doesn't make all triple negatives the same type of cancer. It's also very heterogeneous, and within triple negative, there are probably many different littler subtypes of breast cancer.
Mm-hmm. So Cynthia and Dr. Sharma, I understand that you actually knew each other before you started your treatment at the University of Kansas Cancer Center. Cynthia, how did you meet Dr. Sharma originally?
So it was after I had been diagnosed with my original breast cancer, and I was doing a story with her just about triple negative. I had some people, people that I was interviewing who were triple negative, and it was just kind of a concern. And so I thought, well, let's just find out what this triple negative is. And so I remember interviewing her, and I feel like you were new to the University of Kansas Cancer Center. I don't know, but you were you were in there with your lab dishes and syringes and all the research stuff and paraphernalia that you had, and you were really just trying to examine and discover, what this whole triple negative breast cancer is about and how to attack it and try to cure people. I was very impressed with that. So that's what stuck with me. So when I went to the University of Kansas Cancer Center, and they mentioned Dr. Sharma, I thought, oh yeah, I like the idea that she's a researcher as well as someone who works with patients, and so I'm really happy.
So we talk a lot on this show about the importance of where you get your treatment, and we know that patients have a 25% greater chance of surviving their cancer if they're treated at an NCI designated cancer center, such as the University of Kansas Cancer Center. Dr. Sharma, could you tell us, what does it mean for someone who's been recently diagnosed with cancer in regards to that difference of where you're treated?
So it is definitely, the most important decision that an individual with cancer would make about where they would get treated. And then in this era of precision medicine, targeted drugs, new research, access to clinical trials, to be in a place where one would get a multidisciplinary care approach, have access to the most cutting edge treatment, have access to the most cutting edge investigators and researchers that can look at your individual case and make the recommendation that best fit that individual person's need is very, very important for patients with early stage disease and also for those with metastatic disease. For patients with early stage disease, that initial treatment is your best chance at cure. So you want to have your best foot forward. For patients with metastatic disease, which is often incurable, that's where access to novel treatments, trials, better drugs, a multidisciplinary approach can make all the difference.
Mm-hmm. So, Cynthia, I want to go back and clarify something. When your cancer came back, it was diagnosed as triple negative. Was that your original diagnosis as well?
Gosh, I mean, I don't remember that it was. I do not think so. I think the triple negative was the second time around. Dr. Sharma, I mean, maybe you know, but I don't.
I think it was triple negative back then as well.
Oh, was it? Okay,
yes.
It was. All right, so
yes.
triple negative.
I think it did change biology a little bit over time as it came back. And I think 7 years later, we knew a lot more about this cancer than we did back then. So it helps us develop or tailor treatments for your individual case better.
Yeah, so that's what I appreciate about your knowledge and subset of the research aspect of it. And there's so much happening now with research and clinical trials that's why it's so important to be part of that. I mean, I'm benefiting from others who before me, participated in those clinical trials, so I'm happy to do it myself.
So let's check in with Alexis Del Cid because I think we have some questions that are already coming in.
We're getting quite a few questions, doctors. I actually have a question for Cynthia, if I can ask one. So many people keep their health journeys and what's happening in their lives private, but you made this really big decision to share your journey with your viewers. You're a longtime Channel 41 anchor, and really let us all walk this cancer journey with you as you went through it. Was that nerve-wracking at first? Was that a big decision that you made? Were you nervous the night before you publicly talked about it?
I wasn't. I knew it was the right thing to do. I just feel like there's just a sense of transparency that you need to have when you're on the air. There's a relationship that you have with your audience too. And I already knew that I was being supported behind the scenes, before I went public. I was being supported by family and friends and, my church family and work family. And so I knew that I'd be supported. And my real reason for doing it wasn't about me. I mean, this isn't about me and promoting me. This is about trying to help others and helping women understand the importance of having a sense of community and of sharing and of being transparent and opening up and letting people know what's happening, getting tested, getting checked, encouraging each other to get checked, just creating a community so that we can try to be healthier and we can catch this before it happens. We can catch it as early as possible. No one wants to be diagnosed with breast cancer ever. But if you must be, then you want to be early on. And so that's what I tell people, don't be afraid of the diagnosis, but be afraid of being diagnosed too late. And then you're in a hurry and you're trying to play catch up and the disease has progressed. So I knew that if I want to make a change and I want to make a difference, which is why I do what I do, then I want to go public with this. And my husband was completely supportive of that. My husband, Ed, who stands by me strong all the time. And I appreciate him. And so it was an easy decision.
So if you're just joining us, Dr. Priyanka Sharma and Channel 41 news anchor Cynthia Newsome are with us discussing triple-negative breast cancer and what cancer researchers here at the University of Kansas Cancer Center are doing to create more effective treatments for this disease. Triple-negative breast cancer is relatively rare, which means that it hasn't been studied as much as some other breast cancer subtypes. Dr. Sharma, you're changing that. And tell us about your triple-negative breast cancer registry in particular.
So I've been fortunate to have great support from the institution to start this triple-negative registry, which we started, it's been about 11 years ago now. And we invite all patients with this particular type of cancer at our institution and others to join this registry. And the purpose is to gather information on a large number of patients to study this cancer better. And over time, we've been able to look at many important things which at times might be hard to study in clinical trials because of eligibility criteria. Not many patients are eligible to participate in trials that are studying newer drugs. So we've been able to look at the role of genetic mutations in predisposition to this cancer. We've been able to look at less toxic chemotherapy regimen in curative setting for these patients. We're now looking at blood-based novel biomarkers to detect recurrence earlier than one would see on CAT scans and X-rays. So these are some of the examples. But the registry has had tremendous support from patients. So we now have over 1,000 patients that are part of it, and it wouldn't be successful if patients like Cynthia hadn't supported and participated, because most patients are participating to provide information to future research because they're not personally gaining any new treatment from participating.
So my understanding is that's one of the largest triple-negative breast cancer registries in the world.
That we know of, yes. So it's a tremendous resource for us to learn more about this disease and to develop better treatment options.
So just to clarify, I think you contributed to that registry, correct?
I'm in the
Cynthia?
registry. I am part of the registry for sure, and I'm proud to be.
That's fantastic.
And I think about, trying to help others in the future. 7 years ago when I was, cancer-free, all the developments in research, there are now treatments available to me that weren't when I first was diagnosed with breast cancer. And so I think about being part of that for someone else, and it brings me joy, it brings me happiness.
Alexis, understand we have a question.
Mindy has a question for Dr. Sharma. She wants to know, does removing both my ovaries and having a double mastectomy completely take my risk away?
If I'm interpreting the question right, it might be a question about developing a new breast cancer. So
I think that's what she's getting at.
So for an individual that has predisposition to development of breast cancer, either through a genetic mutation or family history, depending on the mutation that is present, the lifetime risk might vary anywhere between 20 to 70% of developing breast cancer, and it may vary anywhere from 20 to 50% for development of ovarian cancer. So yes, removal of organs at risk does take your risk of developing cancer away, but I think this is a complicated decision that one should make in consultation with your care team regarding the optimal timing of having those preventative surgeries and the risks and the other implications that they might have on your health as you remove these organs.
Rachel has a question. Rachel wants to know, does dense breast tissue mean you're at a higher risk? Dense breast tissue.
Certainly, so breast density is a risk factor for development of breast cancer, the risks for development of breast cancer are very complex and they interact with each other. So often there's not one factor by itself that we can say, oh, this is why an individual developed breast cancer, but it is a risk factor. So women that have denser breasts are often advised to have supplemental screening besides mammogram with a different tool like an ultrasound or an MRI. And again, those decisions on who should have which test may vary based on your age, your family history, and other risk factors. But certainly if you have a mammogram report that says you have high breast density, you should discuss it with your providers and ask that do I need any other screening modality besides the regular mammogram.
I have another question here that came in about diet. And I'm also curious to know if Cynthia changed her diet after her diagnosis. But Lori wants to know, does sugar feed my breast cancer? It's an interesting way to put it.
So, and I think this comes from some laboratory data where there's some interaction between sugar and cancer growth, but it's not a direct relationship as one would envision. I always tell my patients if that was the case, we would see most diabetics develop cancer and others don't, or the diabetics have a higher risk of breast cancer or other cancers, and they don't. So it's not just as simple as sugar. Cancers are very complex and they thrive on many, many, many things, including metabolism to survive and surpass our own body's mechanism to fight it. So no, sugar doesn't feed cancer. Having said that, everybody should have a healthy diet. You should watch the carbohydrates and sugar that you eat. We do know that for breast cancer, a certain amount of weight gain after diagnosis can increase risk of the cancer coming back. So we always counsel our patients about healthy lifestyle and exercise and trying to maintain their weight after a diagnosis. We also know that exercising 3 or 4 times a week and increasing and having a diet that is enriched in fruits and vegetables over time can reduce the risk of breast cancer recurrence. So those are the kinds of advice we provide our patients.
So Dr. Sharma and Cynthia, I want to ask both of you about the importance of patients like Cynthia participating in clinical trials. And I'll start with you, Dr. Sharma.
So, we wouldn't have newer drugs available to our patients if it wasn't for our patients participating in trials. And often they participate in trials without knowing whether there would be any personal benefit to the treatment. Us as researchers and investigators can design the best trials available, but it wouldn't lead to any progress without support from our patients and our community. So I really appreciate the patients in the community being part of it. I also advise all my patients that when you have a new diagnosis or a change in the journey in your cancer, to always ask about availability of clinical trials, because that may provide you access to better treatment, less toxic treatment sometimes, may provide access to better monitoring to detect recurrence early, and it is not like 10, 15 years ago where, a phase 1 trial was us trying to determine if the drug is just toxic. Even now, early phase trials, we have drugs that are highly efficacious and effective for cancer treatment that are in phase 1 studies. and leading to approvals even after a big phase 1 study. So the times have changed for clinical trials, and they're absolutely the only way we make progress in treatment of cancer.
So Cynthia, why was it important for you to participate in a clinical trial?
Just appreciating those who went before me and did. And so now it's almost, it's paying it forward. It's continuing to keep that going forward so that the next generation and the next generation and the next generation, hopefully we'll have solutions and we'll solve this problem. But until then, let's keep helping each other and one another.
So Alexis, I understand we have more questions coming in from our live audience and on Facebook.
I'm getting a few, and they're all asking relatively the same thing. They want to know how they participate in a trial, who do they call, where do they go, do they sign up, do they talk to their regular doctor about it, and what kinds of women do you need participating in these trials?
So I'll take the last question first. So there are trials for every stage of cancer treatment. There are trials for prevention, so those that are high risk for developing cancer, there are trials for them. Then there's trials for active treatment. And then there's trials, diet and exercise and monitoring and long-term side effects of treatment. So the various avenues to get more information on about trials is, of course, ask your care team, your providers. Clinicaltrials.gov is a good website. It houses all clinical trials, and you can search it by your cancer type. You can search it by a drug, and it will list the institutions that the trials are open at. Many of our foundations, like BCRF, Hope, and many others, provide links to trials, so those are good resources. But I would start with your care team, and as we mentioned before, being at an NCI designated cancer center, you don't have to do that work. The care team provides that access to you on a very regular basis, so that burden is lifted off of our patients a little bit.
So let's talk a little bit about cancer screenings, because that's such a critical aspect of the breast cancer story. Screenings for many common cancers, particularly breast cancer, have really plummeted during the pandemic. And Cynthia, what would you tell people who have missed or delayed screenings due to the pandemic?
Oh my goodness, get in there and get screened. It's just it's so important to know. I would be more worried. It would be a constant worry in my heart and mind, and just a distraction to my life if I didn't know. But let me tell you, here's the other thing. I believe in self-exams as well. Both times I felt a lump in my left breast. When I first was diagnosed with breast cancer in 2011, and then also in 2019, when I also felt something unusual. I felt a bump, a lump. And so doing the at-home test, which is your just making sure you do your self-exam, going around your breast tissue and being familiar with what's normal and what's not, and understanding something's abnormal. And I definitely felt the difference, and you'll feel the difference. If you have dense breast tissue versus feeling a lump, it is very different, and it's much harder, and you'll just know the difference. And even if you're not sure, then that's when you definitely want to go in and get checked. So don't forget the self-exam part, but definitely do your annual checks. I did my annual check. I had a mammogram. 7 months later, I felt the lump in the shower. And so that's why I say to everyone, please, do both.
So Cynthia, considering this morning's topic, I strongly suspect there may be someone watching right now who has metastatic breast cancer. What would be your message for those individuals?
Oh my goodness, I just believe that there's hope. My faith is rooted in my Lord and Savior, Jesus Christ. I'm never shy about saying that. I am thankful that God has sent me to Dr. Sharma and the team there at KU. I just think about just being in the perfect little nest for me to get well. And so it's about being positive, but there are good days and bad. There are days when I'm, struggling and a little bit weak, and right after chemo, and then I get a little bit strong, and then it's time for chemo again. But I would say to you, don't give up. Don't give up hope. Life is too precious to to give up. We have so much yet to do and so much value to give. And so as we're going about our treatment, let's make sure that we're being sensitive to people, and that we're giving and caring and showing love and helping others, lift others up, and showing each other love. I think that's important to do. And I think that's part of what helps me make it through the day when I'm having a tough day and when I'm not. I think it's just wonderful to be able to help others. And so that's why I'm doing this interview. And I appreciate the opportunity. Thank you so much for inviting me to be part of this, because, it helps me encourage others. And I think by encouraging others, it encourages me too.
That's great. So something that you've been adamant about ever since I've known you is that you're surrounded by a very supportive group of people, which you just mentioned, including your husband, your colleagues at Channel 41, and really throughout your whole experience. What advice do you have for caregivers and co-survivors who are watching this morning's program?
Oh, God bless the caregivers. They're going through it too. Ed is my co-survivor caregiver. He has, this is tough on him too. He says all the time, you have the cancer in your body, but we have it together. And so those caregivers, they need time to rest and reflect and relax as well. So not just to be always caring and always giving and always pouring out, but take time to refuel yourselves with something that you do for fun, someplace you like to go for fun, some people you like to talk with, or enjoy yourself. Make sure you take those times to do that. And then to neighbors and friends and all who wonder, what can I do? What can I do for my friend who has breast cancer or metastatic breast cancer or any other cancer or debilitating catastrophic disease? Maybe they just even have a cold, who knows? But here's the thing, just find something that you can do without asking them, what do you want me to do? So don't make the person who's ill come up with something that you can do to bless them, but just look at what they're going through, how you might want to just bless them with a game, or a meal, or house cleaning, or I had a friend come over, and she just came in and she realized, wow, the kitchen hasn't been swept in a while, and she started sweeping my kitchen. And I'll never forget that, because I would never in my life ask someone to sweep my kitchen, but I was sure glad she did, and so it's just those little things that can just help somebody along the way. Know that you care about them, and that you're willing to do something for them, and that nothing is too little. And that's showing love. That's what love is.
What a great message. So we're nearing the end of today's episode, and I'd like to hear from each of you. What are you most excited about for the future of breast cancer research? And Dr. Sharma, we'll start with you.
So these are exciting times in breast cancer research. We have many new drugs and agents that are in development. Immunotherapy is new to triple negative breast cancer. There are other targeted drugs that are in advanced clinical trials. And I think most importantly, our understanding of the biology of the disease has advanced quite a bit that eventually would lead us to development of better treatment options.
Mm-hmm. And Cynthia?
I'm all about it. I'm with Dr. Sharma. Better treatment options, less harsh on the body, um, so that we can have a better quality of life while we're going through. Um, but I gotta say, I'm doing pretty good. There's days, when I have headaches or I'm really, really tired. But just lean on my faith and keep going. And if I have to lay down, I have to lay down. If I have to miss work, I have to miss work. You can't it's not mind over matter. This is, major stuff, but better treatments and, more hope for the future, more hope for longer life. Yeah, I think that would be the ultimate for me.
That's fantastic. So that's it for today. Thank you both for joining me to discuss this incredibly important topic. To learn more about breast cancer, visit kucancercenter.org/breast cancer. Join us next week at 10 a.m. for Bench to Bedside. Thanks for watching. Subscribe to our Bench to Bedside podcast, now everywhere podcasts are available.